Welcome to our next Leading in the Context of COVID-19 Bite Size. This time we're going to focus on compassionate leadership. In our first Bite Size on the 2nd of April, we talked about situational leadership and the complex and unprecedented times we were finding ourselves in, the government being far more directive and how we were starting to experience this more directive style within our own organisation. The importance and value of that directive or command and control leadership style is still valid in these unprecedented times. To paraphrase Paul Cracknell, our Deputy Chief Executive, from his blog on the 21st of April, command and control begins with clarity of purpose and mission and helps us share a purpose and build effective communication of that purpose and mission. When done well, it's actually about empowerment. Building on that element of empowerment, it's useful to remember the value and importance of compassionate leadership, which is the reason we wanted to focus on it in this bite size. It also reflects our organisational value of compassion. In their article for the King's Fund on the 30th of March, Susie Bailey and Michael West said of COVID-19 that this moment of crisis is also an opportunity to collectively improve the leadership culture across the NHS. It is vital that as the NHS responds to COVID-19 challenges, leaders and managers model and promote compassion in an enduring way, including self-compassion. Notice that as well as talking about leading others compassionately, they also remind us of the importance of self-compassion, or as we described it in our resilience bite size, fit your own oxygen mask first, because self-care isn't selfish. Continuing with Michael West's work, in his interview for the King's Fund back in October, he described what he considers the 4 key behaviours of compassionate and inclusive leadership. These were attending, so paying attention to those that we lead, or listening with fascination, as Nancy Klein would describe it. Understanding, so arriving at an understanding of the challenges that those we lead face in their work through a dialogue rather than imposing our own understanding. Empathizing, caring for them given the stresses that they are experiencing working in health services and will continue to experience post-COVID, which is key and gives us the motivation for the 4th behaviour, which is about helping or serving those that we lead to enable them to do the jobs that they want and we want them to do, which is about delivering high quality, compassionate care. Of those 4 behaviours, he indicated that listening with fascination is the most important skill for us as leaders and that helping those that we lead is the most important task. This builds on an earlier interview with West back in 2017 when he talked about the particularly powerful role that we as leaders play, when he said, what we pay attention to, what we monitor, what we reward and what we talk about communicates to those around us what it is that's valued in the organisation, i.e. the culture. So it's really important that we embody compassion in our leadership, and that means in our behaviours too. When we empathise, we have a felt reaction to the difficulties others are facing, are able to tolerate that distress rather than over-identify with it, and we take action to help them. We're demonstrating our compassionate leadership and we're helping those that we lead do the job that they want to do. So why does compassion matter? We're going to explore this now in the context of considering what happens in the absence of compassion. When we feel threatened, under pressure, stressed or anxious, some or all of those feelings may be familiar to you or those around you as a result of COVID-19. Our fight, flight, freeze response kicks in, which results in us all of our attention becoming focused on keeping us safe and protecting ourselves. Whilst we're focused on threat, our creativity, problem solving, memory, reasoning and concentration are adversely affected. Remember the levels of thinking and feeling we explored in the resilience bite size. And regularly feeling under threat is emotionally and physically draining. Experiencing compassion activates the calming system, helping us access the mindful state we talked about in the resilience bite size. This helps us to reduce our threat response. Being treated with compassion also helps us feel safe and valued, which improves our cognitive function and well-being. Then in turn, we become more engaged in our performance, i.e. our patient care improves. As Mandip Kaur highlights in Leading with Compassion, the how-to guide for all NHS organisations, If we want our patients to experience kindness and compassionate care in their treatment, then the staff who deliver that care must experience the same kindness and compassion in the way that they are managed and led. Now, despite some views that compassion is soft or woolly, there is robust evidence of its importance and the positive impact it achieves, supported by statistics from the workplace. Employees who strongly agree that their manager focuses on strengths are more than twice as likely to be engaged with those whose manager focuses on weaknesses. High-performing teams experience 5 times as much appreciation as criticism, and I suspect that's the reason they are high-performing teams. And finally, 70% of the variation in levels of staff engagement is driven by the employee's direct line manager. We already know from that evidence that compassionate leadership is not fluffy and it's not woolly. It involves creating the conditions through consistently listening, understanding, empathizing and helping to make it possible to have tough conversations when we need to. This toughness is referenced by Renat Assar, the NHS Chief People Officer, and Don Berwick from the King's Fund during an online event in January 2020, when they said compassionate leadership requires courage, the courage to listen to tough messages from those that we lead, the courage to explore their understanding of the challenges they face and to have our own interpretations challenged and rejected. So how can you develop your compassionate leadership or develop it even further? There are a number of tools and approaches that we shared with you in previous Leading in the Context of COVID-19 Bite Sizes that will support you. These include flexing your situational leadership style to meet the needs of those that you lead, recognising the resilience buckets of those around you as well as your own, looking after yourself by applying the mental health self-care wheel, remembering where those around you may be in both the Bridges transition model and the psychological transition curve, and that different people will be in different situations at the same time. Communicating clearly using the format model, supporting those around you to expand their circle of influence, balancing your own and supporting others to balance their levels of thinking and feeling, and consciously managing the trust bank and the trust equation. So let's look at what else you can do. In the King's Fund article, COVID-19, Why Compassionate Leadership Matters in a Crisis, on the 30th of March, Susie Bailey and Michael West highlighted the core ABC of human needs at work: autonomy, belonging, and competence. Let's explore what we as leaders can do to support each of these. So let's start with autonomy. This is about making sure that staff have a voice and are able to influence decisions that affect their delivery of care and workplace environments. It's about listening to them every day and giving them some control by putting your trust in them. People are more likely to thrive when they're trusted to achieve results without being micromanaged. It's also about helping staff meet their basic needs by ensuring they can take breaks and access food and stay hydrated. Next, it's about belonging. This is our need to belong intensifies during a crisis, and we can support our teams with this by, where possible, creating a positive, caring and supportive environment for your team to work in, where you value everyone's contributions and you ensure that everyone is clear about each other's roles. Finally, it's about competence. All staff desperately want to deliver high care quality during this pandemic. Our role as leaders is to support them to work to the best of their abilities over a prolonged period. With that in mind, it's useful for us to provide opportunities for them to meet regularly, face-to-face, social distance allowing, or virtually via MS Teams or telephone conferences, etc., even if it's just for a few minutes at a time, so that they're able to share their learning and ideas and support one another's well-being. Because these approaches will support you to lead even more compassionately, they are likely to positively impact how others feel about being led by you. You are the lens through which they experience the organisation, and your influence is 4 times greater than any other in terms of how engaged they feel. This is likely to impact the way they complete their staff survey, and there are 6 specific questions about this which ask people to the extent to which they perceive that their immediate manager supports them, gives them clear feedback on their work, asks for their opinion before making decisions that affect their work, takes an interest in their health and well-being, values their work, and supports them with training, learning, or development. Now, when we're thinking about training, learning, and development, it's really useful to remember that 70% of learning is experiential. So it comes from direct on-the-job experiences. 20% is social, from relationships with others, networks, coaching, etc. And only 10% comes from formal interventions like courses, workshops, and program, etc. With that in mind, think about how much learning we and those around us will have achieved once we have the opportunity to reflect on our COVID-19 experiences. It's also reassuring to see that the content of our organisational leadership promises also supports and reflects compassionate leadership. So that brings us to the end of this bite size. As usual, this is just one of a number of sources of support that you can access. You can see the others referred to on the slide there, and I will leave you with the Our NHS People Wellbeing support details as the last slide. And we really do value your feedback. So any thoughts or reflections on these bite size or any of the other support we've provided, or indeed any other support you would like, please do email us at HR Service Support and title your email bite size. I look forward to working with you again on the next one.